Okay.
So we're gonna put that pad and sponge on your left quad. You can relax your legs, you can put them down.
Is that where he wants it?
Yeah, is that okay?
Or higher?
You can rest both legs. There.
You're gonna hold it.
What we're gonna do is a search. We're gonna try to find if there's a spot that actually caused the delayed signal to get your body to work to stabilize you, so you didn't have that fall and so you weren't injured. Because not only are we going to accelerate the recovery from this injury, but we're going to try to pinpoint exactly what caused it and prevent any future injuries from happening,
Okay.
or prevent future injuries from happening based on the compensation that your body could be developing while you're trying to recover from this injury. Make sense?
Makes sense.
All right.
I
So
forgot.
let's grab that black pad.
I forgot to put my glove on. Hold on. I'm just shocked.
You can relax the leg there, Jill.
And I have a habit of that. I don't like go barefoot.
Oh, you don't like to have the feet on the ground?
After a $22 pedicure, right?
Okay. All right.
He's ready.
All right, so then we're going to put that black pad right on top of her. Actually, Jill, why don't you point to the area on your right foot where you have pain when you put weight on it? Where is that spot?
Right here. Oh, we put the black on it?
No, Gary's going to do that.
Okay.
Just point where right here.
Just point to where it is.
Yeah.
That's where we're going to start our search.
Okay.
Because ultimately, that's where everything ended up. That is your site of pain. That is where the injury happened. If it was a delay in the muscle that was what was sent a signal to absorb the force of the movement that you were trying to do, even though we did trip on a blanket, that is where everything ended up. What we're looking to do is find where it began. So
Okay.
let's just the one cable, a normal polarity, 500,
Yep.
1 on, 0 off. Just
Yep.
go ahead and push start. And I want you to turn it up. We're going to try to turn it up to 18. That's where we want to be. But Jill, if it's going to be too intense for you, just tell Gary to stop.
Okay. Is this like a TENS unit?
Completely different. You'll know in the first 2 minutes here that it's not. A TENS is going to be a site of pain treatment, symptomatic symptom treatment. What we're doing is much
feel
more.
it.
What we are involving is going to be movement to correct a pattern.
Ooh,
from what
yeah.
caused,
That's.
not why.
Ooh, I don't like it that high.
Okay. We'll stop there.
What number are you at?
13.2.
Okay.
That's your.
Feels different than a TENS, doesn't it?
Absolutely stronger.
That's it goes to 100, and if I heard Gary correctly, we're at 13.
Wow.
So, Gary, let's grab a hold. Can you maybe move the camera down a tad?
But I am feeling it more in the left quad than in the right foot.
Here's what we're going to do. We're going to scan that black pad around Jill. We are going to find the most intense location, and not underneath that red pad, but underneath the black pad right now, okay?
Okay.
All right. Let's go all around the top of the foot. Anything happening down there, Jill?
No.
None.
Well,
No real intensity.
No. I feel more tingling in the left quad than I do on the right foot.
Is that sponge good wet there, Gary?
It's pretty wet, yeah.
All right. Let's go to the inside. Inside of the ankle.
It's the
Yeah. And I want you to go to between the ankle and the Achilles tendon, right?
Yeah.
Right on the back side. Keep going back.
Oh yeah,
right
I feel
there,
it
1
now.
to 10, what's that?
What do you say?
On 1 to 10, what do you feel in
I-
terms of tingling?
Intensity.
Yeah, I feel it.
You're gonna know if it's intense.
8.
We're at about an 8.
Yeah.
Gary, I want you to
6.
come up. Keep coming up. Increasing, decreasing.
Yeah, it's definitely getting more. Yes.
1 to 10.
About an 8.
Is it dropping off or increasing? Or staying the same?
About the same.
Yeah, let's go back down.
Ooh,
Here.
then I got, ooh, wow, this is something else.
Go back down. Right there. Anything? 8?
I felt more of the impulses going up the leg. When you go down the right foot, I feel more at the quad. Is that
Yeah.
because the nerves are, they rotate?
But let's not concern ourselves with what's
Right.
happening with the red.
Okay.
All we want to do is look for the intensity in that black. As far as the communication between pads, yeah, absolutely. There's a signal being sent. When that signal becomes intense, there's a miscommunication. That miscommunication needs to be reestablished. The level of intensity will tell us where there's a greater miscommunication.
Okay.
So let's work directly back to the Achilles, Gary. All the way behind. Increasing, decreasing, what's happening?
I feel it now, about an 8 right there.
And if we go back to the inside, Gary, what's it there do?
Maybe a 5?
Let's work to the outside. What do we got there?
Yep. About 7, 8.
Okay, I want you to come up the side,
Ooh, yeah.
1 to 10.
About an 8. 9.
Probably you're gonna get a 10 right around that area, but
Yeah,
let's
9, 10. I was
disregard
just gonna
that.
say that. Yeah.
Come up a little bit more.
Oh, yeah.
Alright, let's go back down.
That's
to the
like a
foot.
12.
Yeah, go back down to the foot. Right around there. Go to the front. Right there. What's that? Nothing.
No, there's some feeling there. Maybe it's because of the pain sensation that I'm having that I'm feeling the decrease in the impulse. I don't know.
Well, you can. Pain is. We can work on a pain scale of 1 to 10 on what you feel with it as well.
Right. Maybe a 3 where he's holding it right now.
And if we went back to the front, we'd still be at a 3.
This, which way?
Yeah.
This way?
By the front. Yeah, it's all about, yeah, right there it's getting a little better.
Okay, we want it to get worse.
You want more impulses.
Yeah, most.
more
Yeah.
intensity.
Right,
More
okay.
pain.
Yeah.
So right up here is the most.
Yeah.
Alright, go back up there. Let's find the spot. We're just right below the knee, kind of on
Yeah,
the side, back side.
exactly.
We're on that gastroc. Are we on the gastroc or are we on?
Yes.
Okay. Let's go there then. Hit stop. Put the black pad there.
I also, doctor, I don't know if I mentioned to you that it burns too on the top of the foot.
At all times or just then?
On and off. Even driving here I had to take my shoe off.
Okay.
I need to get it my lifeline, you know?
Yeah. Gotta be able to wear those open toe shoes to show that that pedicure off, right?
There you go.
Alright, let's bring the red one back down there, Gary.
Okay, you want me to, we're gonna search some more?
Yep.
Okay.
So you don't put the pad right on the pain then?
All we would be doing then would be treating the
Result.
last outcome. You know, we'd be treating what got injured, not why.
I see.
And if all we did was treat what, then odds are we're going to have something happen again.
Okay.
We need to correct why it happened, what's causing the symptoms, then the symptoms will be eliminated. If we only treated the symptoms, what caused them would still be present.
Right. Okay.
So let's go back on the top of her foot.
Okay. I gotta turn
Hold
it
on.
up.
Yeah. Put the red on top of her foot. Let's turn it back up. She'll tell you when to stop.
Okay. Woo!
Okay, now we're going to look for the same thing, but underneath the red pad. So no concern with what's happening on the anchor down spot on up on the outside.
Okay.
Just what's happening underneath that red. So let's go. What is it right there? 1 to 10.
I would say an 8.
All right, let's go to the back. The inside. The inside. All the same areas that we went to before. 1 to 10. What's it there?
About a good 7.
All right, come up a little bit, Gary. What about there?
No, it's decreasing.
Okay, go back down. Let's go to the front. I'll go to the outside. You gotta tell us what's happening,
Yeah,
Jill.
about
1
a-
to 10.
About a 3 there.
So not much happening.
No. Now
Wonder-
there is.
1 to
It's
10.
about a 7.
Same thing.
Yes, sir.
And we're on the outside of the shin. We're not right over the shin, correct?
Correct.
Good.
Yeah, I
Drop
feel
back-
that's about a
drop to
9.
the back side a little bit, Gary.
Yeah.
From the outside. Underneath. Anything, Jill? What's
Oh
happening?
yeah, about a 8, 9.
All right, let's go there. But also part of what we're doing in eliminating the cause of those symptoms are treating the symptoms as well by increasing blood flow. We're also getting the muscles back, absorbing force rather than your foot. And where you have pain, absorbing force, that's not where it's meant to be. Muscles are designed to protect other areas from damage. All right. Real simple. All you're gonna do, Jill, is that foot has to be straight. We can't be turned out to the side. We gotta point your toes straight up. You gotta push down and pull back. Push down and pull back. When you push down, I want you to curl your toes under. When you pull back, I want you to curl your toes back. Okay? Very simple. Got it?
Yes.
All right, we don't have to do it yet. Just hang on.
Oh, it's okay.
All right, Gary. Go ahead and put 7 minutes on.
Okay. All right. Go ahead. You want me exact 7 or?
Yep.
Okay.
Hit start. Let's take it up to 7.0.
Okay.
All right.
Start.
I want you to go forward and back 10 times. So that's 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, now stand up. I want you to keep your foot straight. I want you to push down and raise up on your toes. You can use both feet for this. Lift your dress up a little bit so I can see. And face me, please. Okay. Now back down. Back down. Okay, straighten that
Square.
Straighten that foot up. Okay. When you come up, I want you to push down on your big toes so your ankle doesn't roll out, so you come up straight. Up. Okay, do it again. All right, now back down. Now lift your toes up in the air, rock back on your heels. There you go. That's good. Back up again.
You want them square. Her feet aren't square.
Okay, I need your feet to be in line.
Yeah, parallel.
Maybe line up with the tiles there,
Okay.
Jill.
Okay.
Straight up. Back down. Pulling your toes up. Okay, flat again and up. Back down. Up. Or back, yep. Keep doing it here until I tell you to stop. Does this hurt?
No, not as much as before. Feels kind of
Alright,
good.
one more. Alright, let's turn it up to 13 unless she tells you to stop prior to.
Yeah, that's good enough.
You good enough?
Yeah, what is it on?
11.4.
Alright, how much time left, Gary?
4 minutes.
Okay.
Want
I
me
want
to
you to continue doing that for a
Okay.
minute. Yep. Pushing down on those big toes, coming straight up just like that.
Okay.
And you're not using just the left leg, we're using equal
Both.
force in both legs, correct?
Yes.
Both feet.
Yes, sir.
Let's spread our feet out a little bit more. Right there.
I think the pain is going away a little bit.
Absolutely, because we're not relying on those areas for this movement. We're relying on the muscles where they belong.
Wow.
All right, Gary, let's turn it up again until she says stop. So Jill, go ahead and rest.
Okay.
We're going to turn it up again. Tell Gary to stop when
Good.
you can't handle anymore.
Okay.
Can you take more?
I can.
Good.
A little bit, yeah. Okay.
That's the spirit.
Yeah, Bryce is good at figuring out how to get you to do more. I'm just warning you. Okay.
Is it your nice voice or what?
Well,
Okay.
he's been doing it, so he knows how to make you go
He's-
more.
He's good. He's good.
All
Okay.
right, so what level are we at, Gary?
13.7.
How much time do we got left?
2.5 minutes.
All right, let's do this for a minute.
Okay.
Doing a good job there, Jill.
Thank you. You are too.
You got great form.
I just lost 32 pounds, so
Congratulations.
yeah, I got about 60 to go. They didn't know I had thyroid problems,
Okay.
so I'm doing really well.
Anything for that,
We
Bryce?
could structure a program to where you can begin to do more cardio work.
Yeah, I've been walking
we
a lot.
gotta widen out a little bit. We're kind of
Okay, yeah,
closing in.
I feel it. You're right.
What happens when you do cardio?
My husband's a nurse too, and he told me, he goes, Jill, you gotta stay off your foot for at least a couple days, and
All right, let's stop. We're gonna turn it up one more time. Sorry to interrupt.
it's okay.
Tell Gary to stop when you feel that it's too intense.
That's good.
What number?
15 and a half.
Oh, can we make it to 16?
I guess so. Taking Rhythmol for cardiac arrhythmias can't hurt me, right?
No.
Okay.
Okay, 17.
All right, perfect. Can we go to 18?
You can
This is the
try.
last one. We only
Go
got
ahead, I'll do it for
time.
you.
There you go.
Well, this is how he does it, see?
Okay, 1,
How much time we got left there, Gary?
2,
I added a minute and
3.
40 seconds.
Okay. Tell it
4.
time's out.
Okay.
5. That's it?
No,
6.
keep going.
Okay.
Any
7.
pain?
So much better. So much better.
You're lucky you came in because oftentimes ankle injuries can turn into knee injuries because of the patterns that you develop.
So true. You're right. It doesn't stay in one place. It radiates.
And it shows itself up later on, and it's not pretty. So continue going until you feel the signal drop off.
I'm losing weight doing this in my ankles. I'm gonna have nice calves.
We timed down there, Gary? How much time?
I can stop if you want. Because we went over, so I'll stop.
All right. Let's put 7 minutes back on there, and let's go to reverse.
Okay.
All right, so Jim, what we've done is we worked the pattern out from where we found it in the black.
Okay.
And what was happening is that signal was set from black to red. We're going to reverse that signal and send it from red to black because we're going to work that pattern the other way to correct that pattern.
Okay.
This isn't just the physical aspect of what's happening and what you're feeling for the intensity. It's neurological. So the device right now is acting as an outside brain. It's sending communication that your body's receiving and receptive to, and we're making those changes. We're getting those muscles to recognize a message, how
Okay.
they should function when you bear weight, when you step down on your heel, when you push up on your toes.
Okay.
I'm listening.
So let's hit start. Let's go to 7. You doing good there, Jill?
Yeah, I still kind of feel the pain though when I flex it.
We're only halfway there.
Wow.
Need you to make sure that your feet are about 4 or 5 inches apart, though.
Yes, sir.
Okay.
All right, so we're at 7.
Yep.
All right, let's do this for a minute.
The same thing? Same motion?
Thing.
Okay.
Same thing. Pull back on your toes when you come back flat. There, yeah. We should have took a measurement of her foot and the swelling beforehand.
I can pretty much look at it though, sir, and tell a little bit it's gone down.
Your feet are, there you go.
It is better though. I'm impressed. I don't know what I'm impressed with, but
All right, let's rest. Let's rest.
okay.
And
Even when I go like that.
Okay.
what's that?
When I lift my toes up towards my body, towards my face.
Okay.
So you can see ligaments and stuff now and before you couldn't because of the swelling. Is that what you're saying?
No, I'm saying I still have discomfort when I, flex my toes towards my
Oh,
front of my body.
All right, Gary, let's turn it up. Tell them to stop when You want them to stop.
Okay.
Okay.
Let's just do the toes then. I want you to just pull your toes back. And I want you to bury them in the ground. No, keep your legs straight. Keep your legs
Oh.
straight.
Okay.
Stand up. I want you just to pull your toes up and then bury them down. Toes up, bury them down. Make sure your feet are straight, that we're not pointing our feet out to the outside. We want them
Okay.
straight ahead. Oh, maybe it's the camera angle, but it looks like your heels maybe
Yeah.
a little closer together.
Yeah. Make them parallel a little bit better. Okay.
Better?
Looks better.
Okay.
We just don't want the ankles pointed in,
Okay.
straight back.
All right, let's rest. Still got the pain when you pull it up?
A little bit, but it has decreased.
Okay.
Definitely has decreased.
Still got some time left.
Much better.
All right, Gary, let's turn it up again. What kind of patients do you see for your home health care?
Oh, all kinds. Geriatric, hips, a lot of wound care, a lot of circulation to the lower extremities, ACE wrapping, we have to go in and do that. What do I do?
Enlighten her, Bryce.
It's a perfect fit. Circulation,
Oh yeah, that's so huge.
hips and knees.
I
We're
don't-
talking about people who are in chronic pain.
Oh, you
Can't
diabetics?
make it diabetic.
That's the most. I would say 70%.
Can't make it to a treatment facility.
Exactly. Oh, this is going to be mobile?
Yep.
Oh, wow. That's
You
awesome.
can make it because you bill through insurance, right?
Absolutely. That's right. He's a podiatrist. He goes to the homes.
What are you doing right now? Are you going back to work after this?
Yeah, I came here for an interview. But I can still do my other job as well. You know, it's money, it's what I want to do in the future. I want to do something more, you know. I get stale.
Your ankles are pointed in.
All right, let's
in.
rest. We're gonna turn it up one more time. What do we got, Gary? About a minute and a half left?
Yep.
All right, let's max it out here. So max tolerance level there, Jill.
Woo!
There you go. Can we go higher?
No!
What number?
18 and a half.
I
There you
did it! I did it!
All right, let's just keep doing the movement just like that till you time out. Really lift those toes high up in the air. There you go. Try to bury them underneath that tile when you push down.
She's rocking a little bit. Is that okay?
That's all right. I mean, that's going to be a response. I really want to focus on her trying to get those toes up as high as she can and bury them down as far as she can.
I feel that when I lift that foot.
She's gonna sell. She's gonna sell a lot of these machines, Bryce.
What's that?
She's gonna sell a lot of these machines.
Oh, she put them in home. She would get the doctors to write a prescription for a license,
God, yes.
like Dennis was mentioning before. She goes and administers the treatments. Oh,
Not only that, because I have an injury just, you know, and I've experienced it myself. That's huge.
We about timed out there, Gary?
3 seconds.
Doing
All right.
really hard.
Let's go ahead and take those pads off.
So instead of wearing the TENS unit for days, this is more of an intense treatment.
Well, yeah, and what is the TENS unit doing for days?
Exactly. It, you know, it works for a little while and then that's it.
Why is that? Because it treats the symptom,
Yes,
or it tries to.
tries to, right.
Let's put your shoes back on.
Okay. Hold on my shoes. Thank you.
Let's go walk up and down the hallway.
It's better.
Walk up and down the hallway.
Oh my God.
Tell us a number, 1 to 10, when you come back.
About a 3. 2.5,
From
3.
a 7 to a 3.
Yes. Maybe
That's
even,
one time. That's a
maybe
beyond
even
a
a 2.
50% reduction in 14 minutes.
Thank you.
Just think if we came back
Yeah.
for multiple sessions, you wouldn't have any pain or mobility issues.
I
You
think
wouldn't
so.
have limitations in that foot. We wouldn't allow scar tissue to develop. The number one thing is we wouldn't have to worry about a future injury occurring because of the patterns that you have developed from that injury.
Incredible.
So is you back the next day to do this?
Yeah.
Build through insurance, increasing your patient or increasing your outcomes.
Patients will love it if you show them and give them something and provide less pain. It would be, I think you guys have it.
Perfect. So in a 14-minute clip, we created more than a 50% reduction, and that only gets larger as you continue. So odds are you come back tomorrow, you do it, we take that 3 in pain down to a 0, we maintain that change, and yeah, it all happens this fast. And then we get into strengthening to maintain those changes, those neurological changes that were produced during the therapy sessions. So it's a process, it's needed. You see the success firsthand.
Yes, in the pain I do, in the pain level I definitely do, but the swelling, you know that swelling doesn't
That
go
comes on
away.
with time.
Yes.
You know, with that swelling, it comes hand in hand with that force absorption. When we bring that force absorption out of an area that it's where it's not meant to be, back in the muscles where it belongs, that inflammation, that swelling is no longer created and no longer produced. So what's happening is we're flowing that blood out, drawing oxygen, nutrient-rich blood in, flowing that, and the swelling is no longer present. Soft tissue in that area is healed, and we're left with no limitations, no pain.
Do you have a brochure made out to?
Well, we'll get you all everything you need.
Oh, good. I really want to read about it.
And I'm sure Gary's going to collect some contact information. Mark will collect some contact information from you. And
I couldn't even put my shoe. I'm just seeing something. This morning I had trouble putting the shoe on, and